Hi, my name is Teresa Hagel, and I'm a nurse practitioner here at the Essex County Nurse Practitioner-led Clinic. Today I'm going to talk a little bit about cannabis use and chronic pain. More and more, I'm seeing patients that are asking the question if cannabis would be utilized for their chronic pain conditions and as a more natural source, or because they're using synthetic medications that are producing intolerable side effects. Medical cannabis is cannabis and cannabinoids prescribed by a regulated health professional for a medical condition. In Canada, about 329,000 people are using cannabis for medical purposes. A Canadian study by the Red Cross suggests that alcohol and cannabis use have increased approximately 27% since COVID-19 began. Other studies show that medical cannabis users have increased their dose by 91% for conditions like chronic pain. Patients with conditions like chronic pain have deteriorated due to regular medical care like physiotherapy, chiropractic care, massage, and epidural injections being compromised during COVID-19 lockdowns. More and more, I'm seeing patients that want to use cannabis as a more natural approach for pain control, or instead of using a synthetic medication that can produce intolerable side effects. Before initiating cannabis, it's important to know how it works and what it's used for medically. Cannabis contains more than 500 chemical compounds, and those are found on the female plant. Our body has cannabinoid receptors which interact with cannabinoids found in cannabis. There are endocannabinoids, which are naturally produced in the body, phytocannabinoids that are found in plants, and synthetic cannabinoids, which are pharmaceuticals that have the same structure as THC. There are two main components of cannabis. There is THC, which is the main psychoactive component, and produces the following effects: analgesia, antispasmodic, reduces chemo-induced nausea and vomiting, stimulates appetite, and decreases intestinal motility. CBD is the non-psychoactive component of cannabis, and it produces effects of analgesia, which is pain control, anti-inflammatory, antiemetic, antipsychotic, anti-anxiolytic, and anti-seizure. There is also one synthetic cannabinoid called nabilone. In Canada, it is only approved for chronic pain and palliative care. Conditions that support cannabis use is chronic pain, neuropathic pain, symptom management and palliative care, and chemo-induced nausea and vomiting. New studies are emerging that are showing a good response of cannabis to multiple sclerosis, epilepsy, Crohn's disease, anxiety, and insomnia. In Canada, 2 to 3 medical treatments have to be used first before we even have a discussion regarding cannabis use in chronic pain. Now I'd like to discuss a typical case I would see within my exam room. A 65-year-old female patient is in the exam room, and she had a back injury 5 years ago from a motor vehicle accident. And she is currently taking morphine, a 12-hour release, twice a day medication. She takes Tylenol 3 in between to help with pain. And she also is using Advil if she needs to, which is upsetting her stomach. We've tried multiple medications and changing them because her pain seems to be rising up to an 8 out of 10 every day. And a couple weeks ago, we added Lyrica to her pain regimen, but this was intolerable due to dizziness, and she felt like she was falling. The fact that she felt like she was falling and it produced dizziness would be high risk for her because she does have a history of osteoporosis, which makes her a high fracture risk. Because we've tried 2 to 3 treatments, she would be eligible for a discussion regarding cannabis. As a prescribing practitioner, I always suggest CBD strains first, unless they were a palliative patient or they were going through nausea and vomiting induced chemotherapy. I would always suggest taking it orally, either as an edible, an oil, or a capsule, and never inhaling medical cannabis. Conditions that may make cannabis inadvisable is if you're less than 25 years old, a personal or family history of psychosis, active substance use disorder, unstable cardiac disease, unstable respiratory disease, or you're pregnant and breastfeeding. Medical cannabis is showing positive results as more research develops. It is evident that cannabis use has been increasing since the COVID-19 pandemic, both recreationally and medically, and it is important to know the benefit versus risk before using medical cannabis. As a practitioner, I always suggest speaking to your primary care provider first before initiating cannabis, since they know your medical history and if it would be an appropriate treatment option for you.